So lipo areas are not created equal. Or to put it another way, which areas of lipo are pretty easy to get done, fairly high predictability of satisfaction, and which ones do you really need to be careful in terms of the expertise of the person doing it and getting full education of, possible consequences you haven't thought about. So what's the answer here? So I'm David Rapaport. I'm a board certified plastic surgeon here in New York, founder and medical director of Aethos. Let's give you some answers. So what are easy lipo that, now by no means am I saying go get lipo for some quack or some idiot that took a weekend job, that took a weekend course, but I'm saying these are areas that have high satisfaction when done by people that know what they're doing. They're simple. I'm not worrying as much. The classic is the waist. Classic is the waist. If you've been following me, you know that that's my favorite area of all in terms of lipo. I've never met a woman who has said my waist is too narrow, not once, ever. Okay? The beauty of the waist, so it's hard to overdo the waist unless you kind of do it in a awkward way that's not feathered, right? So it looks carved. That you can do if you don't know what you're doing. But the beauty of it is there's not a laxity concern. It's rare for the waist to have a laxity concern because of the way the body's built. This is where the waist is, the pelvis is below it, so the waist just falls down. And that's the beauty of it. Another area in a young person, and only in a young person, is the submental. It's hanging down, but a young person with good elasticity, you go in through here, here, and here, and it's just a beautiful little thing. You're talking cannulas of 3 millimeter and less. These are invisible entry points here, and something looks like a mosquito bite here, done within an hour, local anesthesia. On a young person with good expertise, arms can similarly be easy, outer thighs, but again, needs a little more expertise. That compares with areas that are much more challenging. If I had to say 2 areas that are the most challenging in the body, and that's speaking from me as an expert, but who's not an arrogant asshole. I'm not going to make shit up, okay? The anterior thigh, the front of the thigh, it's a cylinder, and it's a vertical cylinder exposed to sun from above. And any imperfection in it you see. That's why women starting in their 30s, 40s start not liking their thighs just because of the laxity, and they lift it up an inch and it's a whole different thing. But when it comes to lipo, when it comes to trying to sculpt a vertical cylinder perfectly, trust me, it's very hard to do. The other thing that's much more, and we don't do it that often, but there's some people when you look at their profile and pinch them, the way to know if you have a big outer thigh is just to squat and pinch that. Because you might be big because you have big quads. When you squat, the quad is hard. So you're pinching just fat. So I have very little fat here. All right, that's good. But the other area that's commonly done is the lower abdomen. And the lower abdomen is just hanging there. And not trying to be sexist, it can apply to men, but more commonly women are exposing their lower abdomens, wearing bikini, want that area to look perfect. And remember, perfect isn't just not bulging, it's toned and tight. And once you're in your 30s, especially if you're Caucasian and you've had sun and maybe you've had pregnancies, that skin can't take much of a joke. So when you suck the fat out of there, you are unmasking laxity that was there, what I call impending laxity. It's the pillow, the silk pillow that's filled with beautiful stuffing so it's not wrinkly. Then you take the stuffing out and now shit, it's wrinkly, especially when you bend because everything's looser. So you have to be very careful about both, should you do it, how much fat should be removed, and what tightening are you doing at the same time. If you're just unstuffing this pillow, especially aggressively, and not doing anything to tighten that empty sponge, to bring it in, you might be asking for trouble and you might actually regret it. And one of the worst things that could happen to a patient or to the surgeon is to come in with a typical, 40-year-old that has 1 or 2 kids that wants a little lipo, and then you do it and she's freaking pissed, and now she's like, I need a tummy tuck. I can't sit down next to my husband because my lower abdomen's wrinkly and it wasn't like that before. And he asked me, what's wrong? I thought you did surgery. You get it? Not fun for me, not fun for you. So if you think ahead, think things through, we can prevent problems like that. And it's all about knowing what we've got, having a one-on-one honest evaluation that's not guided towards fulfilling your dreams and then disappointing you, but that's based on reality. So that's what I believe in, and hope to see you. Thanks. Bye.